The clinic chain where I worked sold supplements without health registration as certified medical treatments. When I reported it, they threatened to revoke my license. But they didn't know I had independent lab analyses of every product and contacts at the health regulatory agency. There are industries built on fear, not the big dramatic fear, the everyday persistent fear that millions of people have about their own bodies, about their health, about whether they're doing enough to take care of themselves. That fear, when offered a solution in the right language, with words that sound like science and medicine and certainty, becomes the perfect vulnerability for those who decide to exploit it. I worked for 3 years at a company that had built exactly that business. And for 2 of those 3 years, I did not see it because the company was very good at making what it did appear legitimate. I saw it in the 3rd year, and when I saw it, I could not let it go. My name is Natalia. I am 34 years old. I am a clinical dietitian and nutritionist specializing in nutritional endocrinology and dietary supplement regulation, which is a very specific technical area that very few nutritionists know in depth, but that became part of my training because at some point in my career, I decided that if I was going to recommend products to patients, I needed to understand exactly what it means for a product to have or not have health registration and what that implies for the safety of whoever consumes it. That specialization was what allowed me to see what my colleagues had not seen or had not wanted to see. The chain was called Vita Clinic. It had 8 locations in 4 cities, a team of approximately 120 health professionals, including nutritionists, doctors, and support staff, and annual revenue that positioned it as one of the largest weight management clinics in the country. Its business model, on the surface, was that of a serious health clinic. Medical consultations, nutritional follow-up, personalized plans. The kind of offering that generates trust because it sounds like what you would expect from an institution with health professionals. What lay beneath that surface was different. The supplements were the heart of Vita Clinic's real business. Not the consultation services, not the nutritional plans. The supplements, a line of approximately 30 products the company marketed under its own brand that represented the majority of the business's profit margin. The prices of those supplements were those of prescription medications with solid scientific backing. The products themselves were something else. I started to notice when a patient brought me a product that had been recommended to her at another location of the clinic and asked me if she could take it combined with a medication her primary care doctor had prescribed. It was a reasonable safety question, and the answer required me to review the supplement composition. I looked up the product's health registration number in the regulatory agency's database. It did not appear. It could have been a search error. I searched 3 different ways. The product had no health registration in any of the databases it should have been in if it were what the label said it was. I asked the products coordinator at my location for the product's health registration number. She told me all Vita Clinic line products had their certifications in order and that if I needed that information, I could request it from the company's regulatory compliance department. I requested the information from the regulatory compliance department. I received a document that described the company's quality processes in language that sounded like certification, but that when I read it carefully, contained no real health registration numbers. It contained references to internal quality control processes, to manufacturing laboratory certifications, to the company's own standards. Everything that was not what I had asked for. It took me 3 weeks to fully understand what I was looking at because the sophistication of the scheme required time to see in its full dimension. Vita Clinic's products were presented to patients in the language of medications. The clinic's professionals, including myself until that point, described them as treatments, as protocols, as part of a therapeutic scheme. The visual presentation of the products used terminology that in the pharmaceutical industry is reserved for products with registration and clinical backing. But they were not medications. They did not have health registration as medications. At best, they were dietary supplements, which have a completely different regulatory category with different requirements and specific restrictions on what health claims can be made about them. In some cases, when I started investigating the real composition of the products, what I found was that I could not even confirm that the composition declared on the label corresponded with the actual contents of the product, because there were no verifiable third-party analyses to support it. I sent 5 products to an independent analysis laboratory. I paid for it out of my own pocket. The results took 3 weeks. What the laboratory returned confirmed and exceeded what I had suspected. 2 of the 5 products had compositions that differed significantly from what was declared on the label. The differences were not of minor magnitude. One product declared a specific concentration of an active ingredient that the analysis found at a significantly lower percentage. Another declared an ingredient that the analysis did not detect at any concentration. The other 3 products had compositions that roughly corresponded with what was declared, but that in no case had scientific evidence of efficacy for the therapeutic indications with which they were sold at the clinic. None of the 5 had verifiable health registration. I built the complete file over the following month. Laboratory analyses of the 5 products. Comparison of sale prices with the real value of the confirmed ingredients. Record of the therapeutic claims made about each product in clinic materials and consultations, compared with the scientific evidence available for those claims. Evidence of the evasive responses from the Regulatory Compliance Department to my information requests. And something else I found when I reviewed the training materials the company gave its professionals. The supplement sales protocols were integrated into clinical training in a way that made it difficult to separate the therapeutic recommendation from the product sale. Nutritionists received monthly supplement sales targets that were tied to our performance evaluations. We were not only health professionals. We were also salespeople for products that were not what they appeared, without knowing, in many cases, that that was what we were. I went to the medical director of my location on a Wednesday afternoon. I presented the laboratory analyses to her. I showed her the comparison between the therapeutic claims and the available evidence. I pointed out the absence of verifiable health registrations. The medical director listened to me for 30 minutes with an expression that became progressively tenser. At the end, she told me she appreciated my diligence, but that Vita Clinic's products met all the regulatory requirements applicable to their category. That the company had a dedicated legal and regulatory team to ensure that compliance. That my laboratory analyses were useful as internal information, but that it was not appropriate for an individual nutritionist to draw regulatory conclusions that required specialized legal and regulatory expertise. That if I had concerns about a specific product, I could channel them through the established internal process. I told her I had tried that internal process and had not obtained concrete information. She told me she would escalate it to the appropriate team and would keep me informed. That afternoon, I received a call from the company's legal director. The legal director called me with the precision of someone who has had this conversation before and knows exactly how to structure it. He told me the company had become aware of my concerns about the products and wanted to make sure I understood the correct regulatory framework. That Vita Clinic's products were categorized and marketed consistently with applicable regulation. That the laboratory analyses I had obtained on my own had no regulatory validity because they had been conducted by a laboratory that was not the one designated by the company for that type of verification. And that if I continued generating this type of questioning externally, the company would have to consider whether my conduct was compatible with the ethical and professional standards expected of a member of its clinical team, and that if they concluded it was not, they would have the obligation to notify the Professional Nutritionist Association and the corresponding licensing body about the circumstances of my departure. It was the threat of reporting me to the professional regulatory bodies, of revoking my license, in practical terms, or at least of trying to. I listened to everything without interrupting. I thanked him for the call, and that night, I started making the calls he did not know I was capable of making. I had a contact at the country's health regulatory agency, specifically in the Supplements and Consumer Product Control Division. I had met him 3 years earlier at a clinical nutrition congress where he had given a presentation on exactly the type of regulatory irregularities I had now documented at Vita Clinic. We had maintained sporadic professional contacts since then. I called him and described what I had. He listened to me for 40 minutes without interrupting. When I finished, he told me that what I described was exactly the type of case that the Supplements Control Division had long been trying to document with solid internal evidence, and that they rarely obtained because people who worked at these companies rarely spoke. He told me to send the documentation that same night. I sent it. In parallel, I contacted the Professional Nutritionist Association, which was the body the company had threatened to report me to. I did this not defensively, but offensively. I reached them before the company could, with a complete documentation, with a letter explaining what I had found and what they had threatened to do to me, and with a request that they evaluate whether my conduct had been correct according to the profession's ethical standards. The association's president called me the following day. She told me my conduct was completely consistent with the profession's ethical standards, that nutritionists have an obligation to report irregularities that could affect their patient's safety, and that the association would be willing to issue a public statement to that effect if the process required it. The company's threat had become its own mistake. The regulatory agency initiated an inspection of Vita Clinic in less than 3 weeks. The inspection included all the chain's locations, access to product inventories, review of training and sales materials, and the collection of official samples of products for analysis at laboratories certified by the agency itself. The results of the official analyses confirmed what my independent analyses had shown and identified additional irregularities in products I had not analyzed. The agency issued an order for temporary suspension of the marketing of 16 of the 30 Vita Clinic line products while the investigation was completed. 8 of the 16 were subsequently permanently withdrawn from the market. The company was fined for marketing products without health registration and for unauthorized therapeutic claims on supplement category products. I was fired 4 days after the inspection began. The justification was breach of confidentiality and conduct contrary to the company's interests. My attorney filed a lawsuit for unjustified dismissal with documented retaliation that the company resolved in private negotiation before going to trial, with compensation that exceeded what the ordinary process would have generated because the company had reasons not to want the case aired publicly at a moment when the regulatory inspection was underway. The Professional Nutritionist Association issued the statement they had offered me, recognizing that my conduct had been consistent with professional ethics and explicitly rejecting any attempt to use the profession's disciplinary mechanisms to silence reports of public health interest. The threat to revoke my license never materialized, because I arrived first. 6 months after all of this, I found work at a university clinical nutrition clinic where treatment protocols are based on verifiable scientific evidence and where no professional has supplement sales targets tied to their performance evaluation. It is a job that pays less than Vita Clinic. It is also a job where I can look my patients in the eyes when I recommend something and know with certainty that what I am recommending is what I tell them it is. That is priceless. What I want you to take from this story, if you're a patient, if you have ever gone to a weight management or nutrition or any specialty clinic where they have offered you supplements or proprietary products, is this: you have the right to ask for the health registration number of any product recommended to you. You have the right to look up that number in the public database of your country's health regulatory agency, which in most countries is accessible online for free. If the number does not exist or does not correspond to the product, that product is not what they tell you it is. That question might feel uncomfortable, but it is your health, and no one has more right to protect it than you. If this story made you think, comment. Have you ever verified the health registration of a supplement recommended to you? Like if you believe patients deserve products with real backing. Subscribe for more real stories. Share with someone who takes supplements and needs to know they have the right to verify what they are being sold. Practical tip: before buying any supplement recommended at a clinic, ask for the health registration number and look it up in your country's health regulatory agency database. If it does not appear, do not buy it. If a product's therapeutic claims sound like a medication, but the price is that of a supplement or vice versa, research it before consuming it. Your body deserves certainty.